All right, so this panel and workshop is going to focus on moral injury and cognitive dissonance and what that means, particularly in the context of navigating policy change and current events. So we're gonna, kind of each of our topics today, and I like how we did this, is kind of tying together two topics that can each be their own, but we're kind of tying them together, right? So I'm gonna again do some slides, set the context for us, set the stage for the panelists, and then segue over into asking some questions to our panelists today. Same as last time, if you do have questions as an audience participant, please use the Q&A to put them in there, and we'll keep an eye on there as well. To reinforce what Melanie said, using the Q&A versus the chat box for actual questions that you want to see addressed is definitely better, because the chat box, we love how lively the chat box is, but some of the questions will get lost. All right, but keep the commentary going, because we do appreciate it. So I'm actually going to go back to this slide, like at the end. I usually list who the panelists are. Preston, I don't know why there's a typo there. Sorry about that. I added a V to your name. But yeah, it says a little bit of a bio, I guess, for each, just a couple sentences for each person for us to take a look at, but we are going to go back to that. So first, let's talk about what is moral injury, what is cognitive dissonance, how do these things apply to veterans in this population? So there's a lot of literature, a lot of, I guess, commentary out there on like the warrior experience or the veteran experience, right? And like I like to pull from different things, again, just like understanding that not everybody is the same, but to have some sort of framework for conversations like this. And they really are more deeply rooted, not so linear, right? It's hard to set a framework. The spiral on here, I think, says it all. Like a lot of these areas, when somebody is experiencing them, are not clean and clear to describe and define. And that's part of what we're talking about today with this topic, is like, what are these things and how do I navigate them, and what could lead a veteran to this space of moral injury, cognitive dissonance, and what that means. If you are on, if you don't mind just muting yourself from the background noise. Okay, thank you. All right, so when we're talking about integration, reintegration, I think, again, those terms are thrown around a lot, but we don't really actually look at and dive into what that means. Readjustment, we go back to this idea of like that timeline from pre-service to post-service and beyond, right? And what each phase kind of represents and means, and the struggles, the polarity with each of those phases, because there are usually pros and cons, like benefits and challenges, right? Like, this is what's been great for me about this, and this is what hasn't been so great. And those mixed feelings, and really how veterans navigate them and how we can support that navigation. So when someone is returning home and returning to community, like I like to give the snapshot of the Vietnam era veteran who didn't have a solid and supportive home and community to return to. And that in itself inherently had such a such a weight, such a built-in like challenge area for many Vietnam era veterans. And when they think back in their service, like that moment was so critical, that return home from like whatever they experienced during service being maybe not so great. But that moment of return, that transitional point, being really pivotal and defining for individuals. And again, for better or worse, for many of them, it was for worse, right? So not to say that's the only moment that matters, but there is, again, pre-service, service, and post-service areas to look at. And the post-service area changes as current events change. So somebody might return home to a really supportive community and a really supportive family, and they're doing extremely well and they feel good. And then 6 months later, something changes in the world, or 2 years later, something changes in the world that then shifts their narrative. And I think for many who have that experience, that's even more difficult to kind of figure out, because it's like, well, I kind of did some of the unpacking and I kind of have some resolution, but now the whole world has changed in a way that my feelings have changed about myself and about my service, right? That I thought I was kind of standing on solid foundation, but now, I'm looking at it a bit differently. So again, pulling from like different excerpts and different models, just looking at that warrior path, right? And that journey and all of the things that go along with that. And just to give examples, I'm not a fan of like reading every detail of slides. They're really just cue cards, but examples, I'm going to pull some words out, right? So like navigating the old self, the new self, how do I restore myself within the community, making meaning, what homecoming looks like. And homecoming is a word that's fraught with like positivity, right? But also look underneath it on here. It says grief, loss, culture shock, anger, pain, displacement. Homecoming could also be a pretty loaded term for some people, right? Fear, guilt, shock, you know, where you belong in the world, answering the call, right? Leaving home, departure. So a lot of veterans, and again, like some people might hate this term and be like, oh, why is this moderator talking about this term, right? But fall from grace. Like there is this arc of service, and I think this applies to like other professions too, but obviously with people who are to serve, it's like I always feel like it's times 1,000 because it's so all encompassing joining the service and making that decision and signing on the line and really just giving yourself into that career and that service for whatever period of time. There is a huge component of it that can be like super empowering and defining for individuals, right? And it's like you jump in with both feet. And then if it does not go well, I think that that fall from grace or whatever you want to call it, right, has a lot to do with the switch that flips from this all-encompassing huge type of decision experience, immersion into a lifestyle that also has to do with like adrenaline and things like that, right? That are filled in there. Like I'm excited and I'm doing this and there's a mission and I'm training and there's a physicality element to it and an indoctrination. Like I am becoming this version of myself. And when that switch flips, either because someone is separated from the service or because, whether by choice, for medical reasons, or for other reasons, which we're going to look at a few of those today, right? Sometimes it's sudden, other times it's not. But the perception of self and values and figuring out how to then switch gears. And now what do I do with my framework of my service, right? Like it's not always a positive thing. And kind of where to put that, not to mention what we just covered in the last presentation when we're talking about critical issues and things like trauma or prolonged stress, like people's brain chemistry adjust to a certain type of lifestyle. And then it's like you're coming out of that. So there's that dip in the biological experience also for many people. So the switch flipping, right, is kind of like a visual that we can carry with us as we look at this. All right, so this topic I would say is like, it could be controversial, right? If you look at it in a certain way, because I'm about to bring up some subgroups, if you will. I don't even know what to call, but I'm like, all right, subgroups, categories of people. I don't really like categorizing people, but that's what we're going to do just for the sake of this presentation. And the few examples I'm going to give, there are more than what I'm about to present to you, right? And the reason why I'm bringing these up is because I think that just from my work as a clinician, like it's from what I've seen, veteran clients who are from some of these subgroups and are affected by things like moral injury. So it really is informed by like a lot of the work I've done. But again, that list, we can add on to it. And I actually did this presentation, not this one, but one on moral injury. And I had, I think, 4 subgroups listed. And then people actually gave me ideas to list other ones. They were like, oh, how about legally involved? Like they're a relevant population when we're talking about this as well. So I added it on. So if anyone has ideas of areas that we should be adding or focusing on, we're definitely open to it. All right. So a couple other things before we jump into those categories, because we're about to do that. Many people blur the lines between like post-traumatic stress, trauma, and moral injury, right? Because like both of them can have these roots that are identity based and based on experience and mixed feelings. And there is an overlap often. They do not have to occur together. Somebody can definitely experience post-traumatic stress symptoms without moral injury, cognitive dissonance, and vice versa. So do they co-occur? Yes, they absolutely do co-occur. but they do not have to. So a couple things that are universal, again, are like the homecoming, like what am I going home to, right? And this can also inform somebody's feelings of injury on that level, that identity, moral, spiritual, existential level, for good or for bad, right? So think of coming back from like, I'm gonna dilute this, and please, veterans, don't be offended by this because I want to make it relatable, but I'm gonna dilute it down to like a microscopic level. The worst possible day at work that you can imagine. You come home from that day and you've been going for 12 hours, you didn't sleep good, you barely ate all day, it's just been nothing but conflict, you've been dealing with challenges, barriers, arguments, you're trying to advocate for the right things, you're getting all this pushback, you feel like you're just dragging yourself through the front door, right? If you come into a home that is supportive and caring and provides security and peace and stabilization, like that is going to impact how you then carry over into your own self. Like I'm okay. I'm going to take care of myself now. Things are going to be okay. Tomorrow's a new day, right? Like how it would inform that perspective. If you walk into a home that is not supportive and nurturing, and stabilizing for you, what will that do coming off of a day like that? Right? So the homecoming and the community homecoming as well. So that's like the microscopic level to make it relatable to all of our attendees, but on the macroscopic level, right? We're talking about veterans who are transitioning back to their lives as civilians, to their communities, to their healthcare communities, to their clinicians, to their neighbors, their friends, their loved ones, to their employment opportunities, right? To their peers. And these are all like I bullet pointed all the things that it could be, the positive potential with home and community, but with the mindset of like, there's another side to that. Like if these bullet points don't apply, what could that do? So what happens if, right? And I left this slide blank on purpose. What happens if, fill in the blank? If it's not good, if it's not supportive, and they're coming off of that really, really hard day and walking in the door, right? So to speak, that metaphor. And now we're going to add on the impact from current events, right? Historical context, cultural context, fast forward to like current issues that are going on, and policy changes and political changes, right? Like and this is where it gets a little bit like, okay, we're not here to get on any soapbox, but to understand that these things affect the veteran homecoming experience. And that experience is not just like one day, right? It lasts and it's ongoing. It's more of a continuum. So when we look at the social context of war, and I'm gonna move a little quickly. I'm gonna do like 5 more minutes because I want to leave plenty of time for these panelists. We're looking at the socio-political, cultural landscape. We're looking at like, what are we fighting for? What were we fighting for? Each war is different, but these are things that veterans think about because they're super relevant to them. So a clinician might be like, oh, well, we're not going to go there because like we're not going to be religious or we're not going to be political in the nature of the work that we're doing, but it's really hard sometimes to avoid these things, right? And it's okay to go there if this is relevant to the individual. The way I worked with a Marine vet very, very closely for years, and he really helped me to understand this on like a more detailed level, more granular level. It was really helpful. And I really tried to support him through it, but like he would see one news story and get so triggered by it and explain to me why, right? Something that I would have seen, and I, as a civilian, it might affect me like, oh, wow, this is a terrible thing that's happening, or wow, this is going to affect certain changes in the world, but it wouldn't hit me here, right? And this, tough, very compartmentalized Marine veteran that I was working with, it hit him here. Things that I wouldn't have expected. So the media, the news, like, changes that are occurring in our country and other countries. And of course, we know the media skews perception sometimes, and that in itself can be really triggering as well. So I pulled certain images because they were just like the images that came up when you type in like veterans and homecoming and things like that, right? So what do we see when we look at these things? Are we seeing heroes? Are we seeing people that are violent? Are we seeing people that are humanitarian? Like, think of what you see on your perception when you're looking at images that are really, I didn't make these up, right? These are pulled from Google and pulled from kind of media attention. And what do we know about these conflicts? What do we know or think that we know as civilians who are providers in the space? Are there misconceptions, again, regarding combat efforts, humanitarian efforts? Like, our understanding with regards to those things is important. I've also had many tell me, like, I fought in this war and it doesn't even belong to me. It belongs to everybody else, right? I'm just a player. And that realization sometimes can be really difficult, especially if a veteran feels that way and is not getting the support that they need. So, like, some of these mixed feelings can be neutralized by, okay, all of that is really tough, and I'm going to put that over there, but I'm getting really good support. I'm plugged in with therapy, with peers, with community, with the VA, whatever it is. Like, I'm plugged in. So I feel okay, even though all of these other things kind of give me very strong mixed feelings. So when someone returns, right, that those critical moments can also define the kind of retroactive perception that we're talking about and make it either feel better or not so good to that individual, depending on the support that they're getting or not getting. Prime example, again, going back to the Vietnam era veteran and kind of what that experience was like. So layered on top of that is like navigating my place in the world, where I fit in, where I belong, the need to maybe continue to serve, my standards for myself, for others, frustrations regarding politics, frustrations regarding like the state of the world, things like this, right? I was an active member of this conflict or this cause, and now I'm kind of on the sidelines just observing. That alone can have, can have challenges built into it. Some people might say they feel like they're in limbo now. They're in like a waiting room, right? And that in itself can cause dissonance and what we're talking about today or misalignment. All right. So what we know about veterans, and this is, these are some of the really good things, but doesn't apply to everybody. But yeah, many of them are problem solvers, very action oriented. They have high standards. They're purpose driven. And I like to have a framework for my clients. Like if they feel stagnant or in limbo, like that's really not a good place for most veterans to sit. Right. So that direct communication and follow through and movement, especially for somebody who might feel stagnated by, quote unquote, the state of the world or the state of their service and kind of where they landed. All right. Here are some of the subgroups. So I want to quickly touch on these and then segue over. And again, this is just to get us thinking and talking, kind of open up dialogue around these things. So subgroups that are potentially more impacted, just statistically, by like issues related to cognitive dissonance, moral injury, and some of these like identity rooted conflicts, right? Women of service being the minority within the minority, right? Maybe facing issues with regards to their gender within their service, sexual trauma survivors, members from the LGBTQ community, Vietnam era veterans, non-combat veterans, and veterans who have legal involvement or have legal history. And I'll add to that those with like maybe other than honorable discharge statuses, right? People who've been separated out from the service due to legal issues. So each of these could be its own presentation, right? There's bullet points for each of them. And again, I don't want to pinhole us into anything here, but if we take a moment just to look like, and I'm not going to read through all of them, but I am going to just take like 10 seconds on each slide. So women of service, these are some presenting issues that might come up, right? Sexual trauma survivors. And also keeping in mind if somebody falls into multiple categories, they could deepen those layers more and more for them. LGBTQ. Non-combat veterans. Vietnam era. Legally involved. Those with legal involvement. All right. Basic working definition of moral injury we should cover before we jump over. So this is very long, not basic definition. So let's try to look at some of the trends, right? Moral injury involves things like shame, guilt, questioning, anger, regret, betrayal, feelings of betrayal. It can occur with other conditions, doesn't have to. It is tied to one's belief system, one's value system. It can be a result of doing something, not doing something, being involved, bearing witness, or even like feeling a betrayal attached to your identity or your service. You'll notice a lot of what if questions or those shoulds that I had mentioned earlier. There might be inward blame, like blaming self for different things. There could be outward blame as well. There's often a delayed onset with conditions like this. So also like somebody again might feel great and totally organized about their service experience and their perception of it. And then like 2 years later, something happens that causes a shift, right? Either they're ready to kind of address it and the hindsight kicks in and they're like, actually, I'm not really good with the way this went down, or things change in the world. Like I had mentioned before, events, policies, things change that then shift the perspective. All right. And that navigating of the mixed feelings. And there could be like in the same conversation, a great love of service and a hate of service, like in the same sentence even, right? So being able to sit with somebody and meet them where they're at there. All right, I think that's enough content. I always do too many slides. We're going to turn it over to our panelists. Let me pull up the slide that has, um, and I'm going to lean on them to answer some of these questions. What could we do better? And how do we get to this, right? Like, how do we get people from that place of uncertainty or that place of like, I'm not really sure how to support or where to get support for this, like the polarity of what's going on for me clinically. How do we get to this place? I'm going to go back. So bear with me. I'm going to go back to the beginning because we have the more detailed bios up there. All right, here we are. So to our panelists, thank you so much for being part of this extremely important topic and really putting yourselves out there. Can you each just start by introducing yourself and why this topic is important to you, why you chose to sit on this panel? Eleanor, you want to go first? Go ahead. Hi.
I'll go ahead and start since I'm up top. Hi, I'm Eleanor McIntire. I'm an infantry officer. I've been in the Army National Guard for, I had 16 years in September. And I'm sitting on this panel as I'm a transgender service member. I socially and medically transitioned within the military in 2023 to a surprisingly very welcoming community within the infantry, which is always surprising to find just not such a hyper masculine organization to be welcoming. However, the political landscape has greatly changed my service. To include, I was reporting to Fort Benning on Sunday for my captain's career course and was told, hey, we canceled it. That happened yesterday. So that's what I'm here to, kind of talk about my experience.
Talk about real time. Thank you, Eleanor. Anyone else want to jump in?
We can go on third.
Maheen is on as a panelist, but with the camera off, right, Melanie? That's what you said
Yes,
before?
Maheen is here. So
Yes, I can go ahead. So good morning, everybody. My name is Maheen Ahmad. I actually just got out of the service like quite literally 2 weeks ago. So I'm a very recent veteran, and I'm also a pretty young guy. I'm 23 years old. So yeah, I feel like there's a couple things I would like to talk about, especially cognitive dissonance and the current events and some of the current administration's policies.
Okay, Melanie, go ahead.
I'm very, very excited to be on this panel with Eleanor, Preston, and Maheen under the expert care of Aynisa. I didn't introduce myself actually when I did all the intro stuff this morning. My name is Melanie, Corinne. I am a Marine Corps veteran. I served 5 years, left as a sergeant. I was an Arabic linguist, which is military intelligence. Thrilled to have Eleanor, another writer, on the panel. I am a writer. I'm currently pursuing my MFA candidacy in film, TV, and film writing at Columbia. And I am the Dwyer board president for New York State Coalition, but I did what's the word, cut my teeth, doing direct peer contact in Suffolk County for 2 years where I live. And this is really important for me because I joined to have benefits to support my family. If I was born to a, just like Aynisa said, love it, hate the service, I'm so proud of my service, and it was also absolutely terrible. I joined to support my family, take care of my mother. I grew up working class. And so if I was born to millionaires, I probably would not have had the experience of serving. But within 3 months, I joined. I was an artist. I was a writer. Even then, within 3 months, I was told by medical, you have adjustment disorder. You should never have finished boot camp. You can go home if you want. And I like, they were like, you can, you know, they're like, you can, wow, you're keeping your head down and you can make yourself fit into this GI space, but you're not like suited for it. And you can go home. And I was like, no, I'm gonna finish what I started. And that same feeling of displacement and deep displacement, cognitive dissonance, moral injury started for me as a creative, as a writer, from day one, and it stayed with me for my 5 years. So that's why I'm you know, pretty passionate about being on this panel. Yeah, thank you.
Hello, and I'm Preston Brown, enlisted member, and I'm here to represent the legally involved veteran. I'm a 15-and-a-half-year vet. I worked in the comptroller squadron, and going through a very toxic situation in my marriage and my personal life. I resorted to negative coping skills that I've learned. And let me preface, I'm from Shinnecock Nation, Shinnecock Reservation, with all its beauty, but yet with all its socioeconomic disadvantages. When I was 22, I had lost my sister at 21 from cancer. That she came home from release from college on spring break in March, and by June 1st, she had passed away from cancer. The family had made a decision to turn off the life support system after a heart transplant because of the cancer, but the diagnosis was terminal, so we made a choice rather than have her continue to go through. We made the decision to turn the life support off. So this was 2 years in my enlistment. I carried that with me when I returned back from emergency leave. I carried that into my service, and I went directly into work without any self-care, without any dealing with the loss and grief of that traumatic event. And my coping skills led me again to drinking. And we had a saying in the military, work hard, play hard. So, but I can identify and being here with the betrayal of my superiors, my peers, and I'll explain more as we go through the program or through this process. And but I could definitely identify with returning home and having, you know, that feeling of support within a Native community, but yes, yet also that feeling of judgment, you know, with those microaggressions of saying that I could not complete, I could not finish, and that that feeling of failure and that dissonance that came out of that, the regret, the guilt, the shame. So I'm here to share my story, especially and how policy at this time has changed even my current working position, working with a behavioral health agency on the reservation. And there's currently a case that's been issued by the state of Rhode Island against the Department of Health and Human Services, and it grants that support so many of our indigenous people on the reservation and our vets through mental health services, and even through services, direct support services for substance abuse, and how these current policies ended a non-for-profit because of the freezing of funds.
All right, thank you all for those intros and talking a little bit about the topic, kind of just getting into it. And it seems like you all referenced this, so I kind of want to jump right into it. I mean, we'll work backwards here. We're going to go from one of the bigger questions first. You kind of referenced the current events as something that can be like triggering or re-triggering, right? And I just want to think, and like feel free to bring in your personal experience, but also speak about it generally in terms of like how could a clinician support a veteran who they're working with, right? Who is triggered or re-triggered by things that are happening real world, real time, that are kind of like out of their control, and or maybe there are some actionable steps that the person is trying to take to navigate them, but like the emotional triggering component is what we're trying to support, right? Like how can someone do that? What has worked for you maybe, or what have you seen work for others in terms of feeling actually like validated and supported through that process?
Preston, you're on mute. Do you want to share?
Yes, I can share, yes. With current events, one, especially dealing with vendors, being mindful of what they're watching on TV, and it's even creating those boundaries and being aware of what they're watching, the news that is being televised, what is actually triggering, and making a list of what is triggering that individual, as well as coping mechanisms that can help the vet cope with those triggering events, especially being either at home or even within the family, talking about breathing exercises that the vets can do. Again, turning the channel, something as simple as that as well. As far as the funding, and a problem that we had is actually we had to transfer some of the clients that we were actually serving, and finding agencies that could intake that caseload that we had, because of that funding, that's particular to our agency, that funding that was cut, that was frozen. So it's finding those appropriate agencies that could provide those particular services for our clients.
Eleanor, did you or Maheen want to share?
Yeah, so this talk about current events, as a recent veteran, I just got out of the service and I've been met with, so much praise from people telling me, we love veterans. Thank you for your service. This is amazing. Like, thank you for everything that you've done. And I'm sitting there like, okay, thank you. Like, I did a lot of really dumb things in the military, so, but whatever. But I've been coming out of the service with a lot of resentment recently. And I'll tell you guys why. There's two personal anecdotes that I have with current events and the current administration that has effectively affected me personally in a very bad way. So I'll start off with the first one. In 2023, during one of my jumps, I suffered a very bad traumatic brain injury. Shortly after that injury, I developed sleep apnea. And I'm sure many of you guys are familiar with sleep apnea. The average lifespan with a person with sleep apnea is around 65 to 66. It's a pretty severe disease. So I've been getting medical treatment. I have a CPAP machine. I try to use it every night. One of the things that the current administration did, especially the Doge office, is they have been trying to cut a lot of contracts with, different kind of companies trying to save money and stuff like that. One of the companies that they cut a contract with was a company that was going to provide me with a medical it's basically a medical jaw device that goes in my mouth that I can carry it around everywhere instead of, big bulky CPAP. Unfortunately, because of the current administration, they canceled the contract that they had, and I'm no longer able to receive this device. I have tried every single route. I've talked to the VA. I've talked to my active duty military doctors when I was in. They just told me I was just shit out of luck. And that to me screams, on one hand, we have the American public telling me that they voted, they love veterans, they love this. But you guys also voted for a guy that is cutting my own medical supplies. And that to me just it doesn't feel right. My second example is I have been working with a program called Service to School. I've been trying to get accepted into Notre Dame, you all are very smart people, very good school. And, I was not able to get in directly, but they actually introduced a program this year, during the Biden administration. They were going to select 5 veterans from the program, and they were allowed to attend a local community college called Holy Cross. And if accepted, you would have a direct admission into Notre Dame. This was a specific veteran pipeline for 5 veterans. Unfortunately, because of the new administration, the whole DEI shebang, veterans did fall under DEI, that we were a protected class under that. Notre Dame and the veteran affairs guy, his name is Michael. He told me that unfortunately, because of the administration right now, they don't feel comfortable doing programs like this because they're at risk of losing endowments. And a perfect example of this is Harvard. They're losing 3 to 5 billion. They're losing billions and billions of dollars in endowments right now. And I feel like, I don't know. It just does the resentment. It kind of grows a little bit more and more as experience civilian life because people are telling me one thing, but their actions are kind of speaking on another half, and I feel like that's a perfect example of that cognitive dissonance that we've been talking about. So that's basically kind of what I had to say. And then I have one more example. I saw recently on the news that I believe the administration is trying to cut 80,000 jobs from the veteran administration. I looked into a little bit more, and the jobs that they're going to be cutting are going to be social workers, nurses, clinicians. These are going to be people that are going to be treating my traumatic brain injuries for the rest of my life. If I don't have these people available to me, how am I going to get the help that I need? You know what I'm saying? So I have, on one hand, the American public saying that they love me, but their actions just don't speak like that. So, that's just kind of all I had to say.
I would love to. Oh, sorry, Aynisa.
No, go ahead, Melanie.
I mean, I really appreciate Maheen sharing. I do a lot of veterans advocacy in terms of helping people apply to colleges, get jobs. Veterans are one of the biggest recipients of DEI support, which is great because those programs are there to celebrate diversity of our American experience. And I can't think of better, Americans to celebrate than veterans. And so you can see it in a lot of programming. I just want to say that I'm also feeling, some of those, not to that extent, but some of those effects. I'm in academia and a lot of friends that are veterans that would otherwise have, stuff set up, paid for, have the GI Bill, VA vocational rehab, they're getting offers rescinded. And these are these veterans dream programs. So because of funding cuts. But Aynisa, I just wanted to ask you to reiterate your question because I'm a little goldfish.
So that question specifically was like, how do you support, how would you recommend a clinician to support someone who's going through this?
Right. So I wanted to share that, like, if, you don't necessarily have to agree with a vet, but they want to be around their people. Like for someone like Maheen, right? And he's like, I don't like this current administration. They have impacted me personally. There are organizations. There's About Face, which is like Veterans Against the War. There's a lot of there's Common Sense, I think, which is like Veterans Against Fascism. There's like different organizations with veterans that share that lived experience that can also like build communities. So whether it's like political, someone's Republican or Democrat, whether it is, religious or hobby groups, you can, as a clinician, maybe find those resources for your vet. But one thing that I think has helped me is that there's a lot of, suffering, discomfort, frustration involved in the things that we go through, like involved in our experiences with the military that cause this moral injury, cognitive dissonance. And one thing that's always very helpful to me is kind of like a pet or a baby. I feed off like other people's energy. So if I'm talking to someone about this negative experience and I'm a little bit like thrown by it, having someone to support that can show like model, not stoicism necessarily, but calm. I don't react well to like pity, like, oh, I'm so sorry that happened to you. Like, that's a very genuine statement. That's a very genuine, compassionate thing to say, but it also hits me the wrong way. So, not necessarily like, you know, lingering in the I'm so sorry that happened to you. Like, we know it happened. We're sorry too. We don't necessarily need that, but they're like, oh, thank you for sharing. What sort of things would you like, you know, us to figure out how to move forward with that, right? Like looking forward, not necessarily dwelling, not giving the like, not giving the effect of pity, which sometimes can be like misunderstood or like misinterpreted. Like compassion can be misinterpreted sometimes as pity, which is like a, you know, compassion's great, normal human response. And then also like a little bit of I don't want to use the word pearl clutching. I can't think of a better word, but like I once, when talking with friends about a veteran issue, we were in front of a civilian, and another woman vet said something about like how, you know, she had gotten like sexually charged harassment and commentary. And a lot of people reacted with like, oh my God, that's terrible. She was just talking about the commentary she got, words that she received. Words are frustrating, but she also had an experience at MST where she was aggressively and violently assaulted. So for me, it's like if everyone's responding and emoting very you know, very expressively, like, oh, I can't believe that hurt you, you know, that happened to you. And it's like, well, that was just, he just called her, you know, a whore. We didn't even get to the part. We didn't even get to the part where she really was vulnerable about the worst thing that happened to her. So for me, it's like almost, I think, I don't want to say I'm a little flighty or a little like flaky, but like I think it's really helpful when there's like a calm, almost not non-responsive, but just like very even-handed space. Because if I say like, I had to put on my uniform and every time I saw myself in the mirror, I cried because like of the feeling of seeing myself as a GI when that wasn't the life path I wanted. And that happened, you know, for 2-3 years. If I share that and I'm getting a lot of like sympathy and compassion, I'm going to feel very uncomfortable about sharing the more abusive parts of my service. I'm gonna be like, well, that was a, so I don't know, I don't want to go on, but for me, I'm pretty sensitive. So that's something, maybe not with every veteran, but that's something maybe you could be mindful of, maybe not. I mean, veterans are case by case, but for me, that's a big one.
Melanie, I think that's such an important point. I've never heard it described in that way for this topic. Thank you for bringing it up, because I think it applies to so many things. Like if someone starts talking about suicidality and we act shocked and they actually have a plan, they're not going to tell us. Right now, we've shut down the potential gateway to save this person's life. Like that non-judgmental, active listening, holding space, that calm kind of, you're the receiver of this information and you want to be supportive and validating, but not be like, oh my God, I can't believe this happened to you. Like, first of all, I think that's more of a friend response than a clinician response, right?
Yeah. And then Maheen mentioned, right? Maheen mentioned like, you know, people will say, we love you, you served, you're amazing. I don't want to be deified. I don't want people to be gushing over me like I'm a celebrity. If I feel like I'm getting hero worship because I was a veteran, then that feels to me, that reads inauthentic. That reads like you're supporting my title as a veteran, not me as a human being. And there's going to be a companion to that comment. There will be a companion panel tomorrow. Tim Scott, Veterans Are Not a Monolith, exploring the humanity of veterans as people, like beyond their veteran experience. But it causes a bit of moral injury. I think many of us, I mean, younger vets also don't necessarily love thank you for your service for that reason. I'm sorry. Okay, Aynisa was in the middle of talking and I
No, it's great. It's great. Does anyone, I have another question to kind of segue off of this, but does anyone ever else have commentary?
Eleanor didn't get to talk.
Yeah, go ahead, Eleanor.
Melanie, you touched on it a little, and I just wanted to like kind of piggyback on, especially with my experience, and I think a lot of the ease at which veterans and service members like find themselves committing cognitive dissonance between who they are and then who they are in the context of the service is pretty easy because we ascribe to be part of something bigger than ourselves. And because of that, so many things can happen that are outside of our control that we kind of make a break of responsibility with. But because veterans do seek out things that are bigger than themselves in organizations like that, I really feel like pushing a veteran towards community is one of the best things that can happen. From my personal experience as an undergrad, I went to Baruch, shout out to the CUNYs. I was in the Veterans Lounge every single day. It was our safe space. Even though I was kind of just a regular college student, I was a little bit older, I was 25. But all of us veterans were a little bit older, but we had life and lived experiences that were very much different from the other college students. And just to be able to have a place to decompress or to BS amongst each other about the day, about our courses, and to reflect on our service kept me going to school and showing up each day. Even more recently, within the past 4 or 5 years, through organizations like Hope for the Warriors, I've been paired with groups of veterans to sit on Zoom like this every week and play Dungeons and Dragons and role play and tell stories and be creative and imaginative, all within a veteran community, all with people who I was paired with when I signed up for the program, and being able to then, in a kind of very safe but silly, fun space, work out, for myself, gender exploration, conflict resolution, family trauma. I'm thinking about several other veterans that I play with as well. Being part of those organizations, being pushed to stay with and keep up with community has been extremely helpful.
So, if you don't mind me just butting in real quick, the thing about the gender and sex and the whole LGBTQ stuff that's going on, I have another personal anecdote that I just want to share with you guys that I feel like is a little bit pertinent to the conversation. I had a soldier. He came in as a E1 and he got promoted to sergeant within 3 years, which is very, very impressive. If everybody in the military knows that. And this person was a transgender individual. And I'll tell you something right now. This one of the best soldiers I have ever met in my entire life. One of the most kind, compassionate sergeants. All this person's soldiers would come to him for problems every single time, and even I would too. And he was not my leader. This person got kicked out in the last 3 months. It was a very if anybody knew this person, and I was in the 82nd. The 82nd has a very big macho man culture, but every single macho man loved this individual so much because, in my personal opinion, if you can shoot, scoot, and ruck, that doesn't have a gender to it. That doesn't have any type of. The title of a soldier is something that has no race, no ethnicity. Anybody can become a soldier. You know what I'm saying? So, another impact on the administration. I saw my buddy get kicked out. One of the best soldiers I've ever seen in my entire life. Physically, mentally, just absolute beast. And he got kicked out. That does not, that just adds a little bit of resentment to my heart. Because, really, why would you kick him out other than for political purposes? This was an excellent soldier. So
Yeah,
that's just kind of how I thought about it.
It's been very clear to me that if you do not know any trans people, then the kind of political focus is easy to buy into, and as soon as you know a trans person, that all fades away. That's been, certainly when I transitioned and I was enlisted for 10 years. I was an infantry staff sergeant. I commissioned, became an infantry officer. I've only been in the infantry my entire career. Very hyper-masculine organization. I've seen and heard all of it.
Right.
However, to then transition, and I was the executive officer of my company at that time, I was honestly terrified. instantly like beloved and held up by my company. And everywhere I went, it was the same thing of this past summer, I did a JRTC rotation with a completely different state. So walked into a battalion of 500 people that I did not know. They all knew who I was because I was the one transgender soldier. However, within an hour of opening my mouth and them saying, "Oh, she's competent. She knows what she's doing. Those badges aren't just for show. Yeah, let's go." And I just fell into that formation and was able to lead immediately. It just takes literally meeting a trans person to realize that, unfortunately.
I just wanted to add, like, the U.S. military is a very common problem. We are struggling with recruiting and retention. This is a
Yeah.
very common problem. Actually, the FBI and the CIA actually came out and addressed this as a national security concern. So it's just so strange to me that we have so many amazing, qualified people that want to risk their lives for our country. But you guys, we want to have prejudice against them for things that, quite honestly, have nothing related to being a soldier. I think that's just a little bit. I just think that's a little bit unfair, honestly.
It's definitely hard, and this is always, the military is not exclusive. It's always been good at excluding, right? Like this is, the Marine Corps is a very hyper masculine, hyper aggressive branch, right? And even the women that honorably served in it, get othered for, being women, being in the military. And we had Montford Point Marines, right? Like for a long time, Black Marines had to serve separately and go through different boot camps where in Montford Point, which is worse than Parris Island, and they were treated worse and more aggressively by their drill instructors. You guys might know the mayor, former mayor who passed, David Dinkins, was a Montford Point Marine, New York City mayor. But the military has an exceptional capacity to other people. I mean, even all of our brown, Arab, or Muslim like service member companions that serve post 9/11. I mean, what a service that, serving honorably in uniform, supporting us, and the amount of racism and just aggression, bigotry that they had to put up with. That, and especially I, as an Arabic linguist, even, would see was just atrocious. So there is a lot of othering. And then when you're in those small, intimate units, the people next to you are generally good. The people next to you that you can see are good. Oh no, we didn't mean you. I'm sorry, I'm going to use a slur. We didn't mean you. We meant those Hajis, not you. And it's like, well, why would you, if I'm an Arabic speaker, or, why would you, oh, but it's them, not you. And so, like, I mean, I don't know what visibly queer looks like, but I am in a straight passing relationship. So I'm never going to be the one that gets harassed for being LGBT. But I was, on very good rapport with one of the chaplain's wives that was a staff member at a testing center at Camp Lejeune. And I'd seen her several times. Rapport, great rapport. I'm a white passing Latina. I'm a straight passing Marine. And because I was, maybe white straight passing, like the locker room talk that she turned to me one day and said about those people, the gays, right? The trans people. And I was like, this bitch doesn't know I'm one of the gays. But the military can, it's simultaneously full of people that will risk their lives for you, that will be your best friends for the rest of the world, like for the rest of your life. And it's also full of people that you expect to take a bullet for you and will sexually assault you when you're vulnerable, or will, stab you in the back, or tell you you don't belong to be there because you're XYZ. So it's a really confusing environment, even in the best of circumstances.
Yeah. There have been some very positive policy changes as well, especially for individuals who have been, like myself, who have been discharged with a bad conduct discharge. And if you're dealing with a client that has been discharged, many times, for myself anyway, I've separated myself from even the military, or even changes that's happening in the military, and really just being asked to be on this panel. I was finally able to identify my feelings of guilt, shame, the remorse. because before that, it was clear and really undefined, as Denise was saying. And to put the label on it as moral injury and what had happened. But now vets that have been discharged with bad conduct discharge, we can receive the benefits of mental health. There's also education benefits that are available. So many times veterans that have been discharged with the bad conduct discharge, we isolate ourselves from what we're entitled to because of the hurt that was experienced while being in the military. So I do see that as a positive, and I will be moving forward on some of those policies as well.
So on that, and I don't want to stop this conversation at all. I'd rather me not talk anymore and you all just take it away. Because this is really great content, but I'm going to try to guide us a little bit along the way. So I'm always mindful of like being the civilian clinician and the fact that there's hundreds of civilian clinicians on there. And I'm like thinking of what I needed to learn, and I am learning still along the way that has helped me to best support a veteran client potentially, right? So my question is this, and I don't want to I want to ask this without stigmatizing it, but can you speak about directly what the psychological effects might be on yourself or that you've seen in others spiraling off of these things, right? So we're talking about moral injury, we're talking about cognitive dissonance, like that can lead to depression, anxiety, suicidality. It can lead to self-medication. It could lead to somebody feeling like crap, right? Like, what does that look like? Can you speak about that? And it could also just be statements like, I'm not good enough, or like, why is this happening? Or this is really unfair, right? Or unjust. Like things that feel unfair and unjust aren't even statements about the self. They don't have to be statements about yourself. It could be general, like a narrative that might be intrusive to you, like that your every day is riddled with this feeling of like Maheen, I'm sure you're living this now with the whole medical issue that you're struggling with. Like it's unfair, right? And like just concepts or beliefs or statements or diagnoses or symptoms, like anything that you could identify. So civilian clinicians can kind of have that framework to think of as well. And also like reality check. These aren't just like, talking points. These are things that can lead to worsening conditions as well.
Yeah,
Aynisa.
so I can give you a perfect example of how it is directly affecting me in my mental state. One thing that I am very, very worried about is losing my disability rating. The current it gives me so much anxiety because I'm going to be completely and utterly honest with you. If the Veteran Administration does not give me medical care, I will not live a good life, to be quite honest with you. The TBI was pretty severe. It was a bad accident. And I believe his name is Hexeth. Can somebody correct me on that? Hexeth, yeah. He's been on Fox News saying verbatim that, he doesn't believe that a lot of veterans that are currently receiving disability benefits are actually, rightfully receiving those, which I think is, a huge disservice to these guys that are jumping out of airplanes and, doing all these crazy things, because it's like we need this. We really need this help for us, and that gives me a lot of anxiety because I cannot afford to lose my medical care.
I know that when when I have these experiences, it feels like I don't want to say a disassociation because I don't know like that clinical term, but it feels like the dissonance, the cognitive dissonance. It feels like you're looking at your own body through a window, but like I've talked to other people that have gone through cognitive disassociation. They've gone through disassociation. They say they can't remember. So I remembered what happened, but it feels like a full body for me, full body anxiety, almost like a weight, like a pressure. And it feels like I'm almost like I'm trapped in my own body or like looking through a window. And it's a weird feeling because especially because in the military, the things that cause these feelings, like for me, it was putting on my physical uniform. Eleanor, I don't want to be insensitive, but like it almost caused a body dysmorphia, and I feel maybe perhaps you'd know and be able to speak to that more than I would. But
Disassociation, and I was like, yes, that's what I'm talking about.
yeah, so it's like, I remember there was I remember there was a moment, and these are mundane, right? Like my issues with this are not, affected by policy change. This is just my sensitivity. Someone, like Maheen and Eleanor, they're going through the way policy change is like affecting them. This is just the nature of the military caused my cognitive dissonance and moral injury. So it's a bit different in terms of the severity of the repercussions, but I live with it anyway. I remember there was a time on rifle range where I had a sergeant had said something, and I was, a lance, so I was not the same rank. And I said, "Oh, I believe that information has been updated, so this is the new thing." And I got reamed, destroyed for saying that in public. Like I got told I was insubordinate. I got humiliated in front of like 12 different people. And I remember thinking, this is pretty abusive and pretty degrading, which is like perfectly on par for the Marine Corps. But it is my job as a professional to act within the scope of a GI and a good service member, which means not arguing back, not defending myself, and just accepting this degradation and just this disrespect, because the role of a lower rank is to render immediate obedience to orders and, discipline, be a good subordinate, do not talk back, even when they're wrong. That's something that we had been taught. And so I put up in front of other service members that I respected and wanted to consider me a professional. I put up with this, huge beating, verbal, and, it hurt more because she was also a senior like woman Marine that I actually looked up to. And then later she walked over, like after we were alone, she goes, "Oh, thanks for sharing that update." And I was like, bitch, and like, it's like, I just remember that day in that moment, I was like, well, I'm not allowed to be a person. A normal human would be like, hey man, that like, what are we doing here? But by virtue of trying to be the best Marine is not a fully fleshed out human. Those two things are not the same things. And so for 5 years, I conducted myself with this level of professionalism that was literally not compatible with how humans fucking react. And it's like, of course, that leaves you discombobulated and causes, marital issues and communication issues and, anxiety issues. So if, it can be all self-imposed, because I could have been a worse Marine and just been like, hey, this is kind of extra, right? I could have not lived up to the standards that I had set for myself. I wanted to do this. I wanted to do it well, and doing it well really fucked me up. Yeah, sorry, Eleanor, I want to hear your...
No, I think you jumped on something I was thinking about is you fragment your identity, like just the simple act of putting on the uniform. I mean, people talk about having like a ritual when they come home and de-stress from work, and a lot of times it's similar in the military, but just heightened to such an extent, because like you want to be a good soldier or Marine, airman, you want to excel in that. What does it mean to be the good service member versus an ethical citizen? When I think about myself and what I'm going through, like, what does it mean to be a soldier, an officer, the ethical citizen, the trans individual? What does it mean to serve in empire when you become disillusioned with policies overseas, or kind of see, wow, this is what I had friends die for, and nothing has really changed, and people just enrich themselves, but I still want to help my community. California, I've transferred from the New York to the California Guard. California's on fire every year. I still want to get activated and go fight wildfires and help people. But what does that mean in the greater context of serving in the American military machine? Like, every time you go and do something, you're breaking off a piece of your brain and shutting something else down, and kind of like it's like hyper focusing just on one aspect of yourself to the detriment of everything else. And when you mentioned disassociation, like that's exactly what I thought about as well. Is like, you kind of put yourself on autopilot. You fall back to the level of your training. Hopefully you have a high level of training to fall back to, but you fall back to that level of training due to stress or environment, and then just watch yourself perform, almost like from a distance.
For myself, just speaking of the moral injury and really just understanding what moral injury is, and understanding that I didn't assume the full responsibility of what I was going through. So my situation was, I had spanked my daughter one time. My wife reported it. The Air Force initially said it was an isolated incident. And then my wife and I, we were going through marital situations. She came back. She used lies that was against me. And she said there was spouse abuse and child abuse. The Air Force substantiated both the child abuse, spouse abuse. The local Department of Social Services, CPS, denied it, found no validation within it. But the Air Force was putting me through as the perpetrator and going through the whole process. And my daughter is Paulette, namesake after my sister. And my family's falling apart. I'm trying to provide this protective environment for my daughter, chasing my daughter. And the more that I, and still maintaining the image and following the creed of an airman and our integrity, service before self, and excellent in all we do, but yet not being able to hold up emotionally. And I returned to the alcohol and the drugs. And I was urinalysis popped with a positive urinalysis. And so they court-martialed me for use and for possession, but they would not allow what I went through emotionally within that situation. They would not allow that into the court-martial to even show a story of the betrayal. So my attending officer said I was just a common criminal. My first shirt brought in a military police who threatened me. My supervisor berated me. I was put in a position to empty the trash for my subordinates, those who I supervised. So it was just a period of shaming going through. And a lot of this I took on, and I'm thankful the way I received was of my faith. And at the time I didn't know my Lord and Savior. And I had to, and I was going to marriage counseling. I was going to a counselor, but the Air Force said I could not go outside of the military, that I had to perform everything within the military. And even the due process of what happened, I actually filed a complaint against, because within it, my children were not even brought in and questioned as far as what was happening in the house. But they took the word of my spouse, who literally told me I would destroy everything that you have and what you do. So when it's not for the pity, but it was going through, but it was those feelings that I was going through, and I turned to alcohol, I turned to the drugs. And rather than helping me in that situation, or even dealing with the situation of never once in the Air Force career did it ever come up about how are you feeling as a person about losing your sister. And I was still processing her death, and I haven't come through acceptance. So the moral injury of not having my leadership being behind, when the ethical code of the military is regarding freedom and guarding freedom of justice. We defend our country with our life, and I will never leave an airman behind. And I felt left behind, and I felt stigmatized. And there was nowhere to turn. So for me in the situation, really learning what moral injury is processing it. And now I'm at a point in my life, and I'm thankful that I am strong enough cognitively, spiritually, to now really address these issues. Because this is 20 years later and more that I'm coming back and now addressing these issues and saying, wait a minute, there might have been more than me assuming the full responsibility and that having that feeling of failure.
Can you all speak to the timeline of impact? Like, this could happen at any point type of question, I guess. Like, it's not, I think it's non-linear, right? And a couple people had asked, like, I've been trying to scope questions here and there, but even about like discharge from the service, what that looks like. Could the onset of this begin there? Does it usually, occur later? Is there a triggering or re-triggering effect that accumulates over time? Could this potentially be delayed like years post separation? Or is it something that could potentially start during service, right? Like, the answer to all those questions, I think, is yes, right? Like, it could be anywhere in the timeline. But can you speak to that maybe from a personal experience? People can understand that. Again, it's something for clinicians to be mindful of, I think.
Ms. Aynisa, I was discharged in 2000. And when Miss Melanie asked me, and I saw what moral injury was, and I told her, I wept, I cried, because for things that have not been understood for so long, and I'm taking personal responsibility for, that I'm now able to identify and say, wait a minute, let me sit back and do the self-exploration, even in a greater way. And I'm thankful. I talked about the policy changes now and having the ability to go to the VA to seek counseling specifically for the harms that was done in the military. Then now I can speak to counselors who have a greater understanding of what moral injury is, what the cognitive dissonance is. And so for healing for myself. So I'll leave it at that. And that's 20 years later.
Yeah.
I'm just now able to say I can deal with the hurt or address the hurt.
Can anyone else speak to this, or would you want to? You don't, no pressure.
Can you repeat the question? I was listening to Preston talk.
Timeline. So like
Okay.
delayed onset, early onset, re-triggering episodes.
Mine was always in proximity to like the military, which caused it. So like things, you'll never catch me in one of those veteran hats. I mean, like, I'm happy that they make people happy, but they're not for me. I don't like moto spaces. I don't like, I read a transition book where the like founder of this very prestigious, I'm not gonna share the name, but the founder of like this very prestigious military transition, like career support nonprofit, like, wrote a book, and I flipped through it, and the whole thing, this person was an officer. No shade. We have Eleanor, which is like, so officers can be
But I
officers,
was
right?
enlisted first.
Yeah. Oh, I thought you said you're an infantry officer.
But I was enlisted for 10 years.
Okay, but
So-
okay, so yeah, all right.
so-
Eleanor is a Mustang, which is when you start enlisted and then become an officer. That's the slang term, Mustang. Marines respect Mustangs and warrant officers, which get promoted on merit. If you're a normal officer, you have to
Yeah,
you
we
have
don't
to
like
earn the respect. But wait, what was I saying? I just got so sidelined.
moto spaces.
Oh, monospaces. Yeah. So this officer wrote a book and I read it, and the jargon and terminology was like, hey there, killer, are you ready for your next mission? Do you want to know the lateral limits of, and I was like, oh my God, this person is the head of like a multi-million-dollar nonprofit. It wasn't my book, so I couldn't throw it in the trash. But if it was, I would have, because it was so offensive for, someone like that to assume that we are just idiot peons incapable of embodying our own humanity beyond the bounds of the military. There are people and service members like that really truly don't know how to function without the guidelines, the terminology, the space of the military. But there's also a huge demographic that will purposely distance themselves from it. And so as a clinician, it might help you to know which type your person is in front of you. And so for me, I know that is something that exacerbates that feeling. And if I'm away in a kind of more neutral, maybe civilian oriented space with people that are just open to veteran stories with other veterans, right? I feel a lot more free to be myself. But you know, again, like, it's different every veteran. So this is just like the scale. I think a lot of what we're going to do in this conference is helping you understand the range of how veterans may respond to things. So you're aware that you're not looking for one or the other. You're gauging where they might be comfortable.
Then anyone else want to speak about timeline or triggering or re-triggering of moral injury?
I can just throw in really quickly. For me, it was in service and around veteran things. I have a best friend who was my literal roommate. She's amazing. She got me through so much of my service. She was my roommate for training 2.5 years, and then also in the fleet. So out of my 5 years in service, I was with her almost every day for at least 3.5, 4 years. She went through fine. And then the day she EAS'd, like, spectacular explosion. And she has been treading water for the past 5 years. And I think she got like stable in terms of like housing benefit support like 2 weeks ago. So some people do that too.
There's a question that came in really well worded that I kind of want to just read. We have about 10 minutes left, I know. So what are some things we can do to alleviate the suffering of veterans who continue to feel they've failed to meet that they have failed to meet their cultural norms and expectations, like an Indigenous vet who was unfairly discharged and now feels that he or she has been shamed for their warrior culture. That's just an example, but things that we can do to alleviate the suffering of veterans who continue to feel that we've failed to meet their expectations.
Is it possible for me to answer the question from Nancy?
Sure, go ahead.
So, one way I feel like, and this is like a super cookie cutter answer, but really, I feel like one of the basic ways that we can help people without the DoD support is really just educating, trying to give more resources out to people that are maybe not the most familiar with, like, some of the mental illnesses that a lot of veterans end up suffering post-service. For example, one thing that I really struggle with a lot is I'm a non-combat veteran. I've never been deployed, and I often don't feel like a real veteran. I have buddies that have been overseas, just like many of us, and that have lost their lives. And sometimes I feel like I was never deployed, but my buddy went over there. He got killed in action. What the hell am I doing? I don't deserve any of this. And I don't know, it's just something that I struggle with post-service, especially in these last 3 weeks. So, yeah, that's kind of.
Ms. Anise, I know as clinicians in dealing with indigenous cultures, and it's not indigenous cultures, not only Native American, but also of Latin origin. Many times as clinicians, we want to practice evidence-based practices. And what really needs to be focuses on is cultural-based practices and tradition. So being culturally aware of the clients that you're dealing with, the traditions that they come from. And I say because evidence-based practice is from a Western science, it's empirical research. But when you're dealing with an indigenous person, you have to look at colonization as well. So when you talk about indigenous people having to push back to evidence-based practices, you have a colonization framework, and you're coming to treat someone who's been impacted through colonization and Western science. So SAMHSA was awesome as far as providing practice-based treatment programs. And SAMHSA now is one of the programs that funding is being stopped. What's happening in indigenous communities. So cultural competency is first and foremost. In evidence-based practices, there could be other, just use multiple modalities and see where it works, especially if you're experiencing pushback. And what really works great is holistic approaches and spirituality. For indigenous cultures, spirituality is preeminent, is our strength. And I thank you for everyone who is giving me the encouragement for my faith and the strength. So I appreciate you all, and receive your strength. And we cannot forget about the spirituality when it comes to healing.
Agree with everything Preston said.
Yeah, I just wanted to jump in on Maheen, your comment about being a non-combat veteran. As you're transitioning recently out of the service, I'll say that like the kind of military civilian divide that we talk about, and that's been part of this discussion of trying to understand, like civilians trying to understand what veterans and service members go through. Honestly, that divide will only really help you as you get further away from your service. You realize that the majority of the civilian population has no idea what you really did, and combat, non-combat, whether you were a grunt or a pogue, it all blends in together unless you were like a Navy SEAL or something, because that's what people know from movies. And what matters the most is like taking back that like you did raise your hand, you signed on the line, you were injured as well and like served honorably. So regardless of like a combat status, people don't really understand or differentiate that. And as you kind of move away from the service, you'll realize only people that are in care about that. Like no one cares on the outside if I have a Ranger tab or not.
Right.
Like
Also, that's, yeah, that just what Eleanor is saying, that's also like a military habit, is like if you didn't, if you didn't serve in combat, you'll be like, but only if I did serve in combat, then I'd be a real vet. But the vets that serve in combat, again, if you guys tune in for Tim's amazing panel on vets are not a monolith tomorrow, it's our ending panel. He'll tell you some facts about like 60% of, or he'll give you the stats. A majority of veterans that do go to combat do not see, they're in combat zones, they don't see combat. And then the majority that do see combat, they don't get physically injured or physically injure someone else. So then they're like, I'm not good enough. I was, I have, and then the ones that did get physically injured are like, well, I recovered and my friend lost a limb, right? It's like, not the no true, it's like the no, I guess it is the no true Scotsman fallacy, right? Like if you just what Eleanor said, if you raise your hand to serve and you take your oath, then you don't control where the government sends you. But as veterans, a lot of us carry that insecurity and have to work through it. In my service, I did things that if I were in another branch, the exact things I did would qualify me for combat veteran status. Because I am in the Marine Corps, they're like, get the fuck out of here. That's a Tuesday. You're a little bitch. You're getting nothing. There are benefits tied, to that. There are like in the Navy, if you're in combat waters for, I think like 30 days instead of 29 or 31 days, if you're in combat waters without a shot fired, you will automatically get the combat vet status, right? Now, compared to someone that's operating a drone, compared to someone that is, in country but didn't see a firefight, like even within combat, that designation is not clear, even within the combat vet status. So I just want you to know that, Maheen, what you're going through, a lot of us do go through, and it's also something that isn't straightforward, as we might expect it should be.
Right. And thank you so much, Eleanor and Melanie. I greatly do appreciate those words. I will take that to heart. Seriously.
All right, any other last minute combat vets? I'm like,
Last minute combat, go.
oh yeah, last minute comments from our panelists on the topic. We do have to wrap up in a minute, but I want to always leave space in case someone has like a thought that they want to bring to the table before we close. All right, what a great group of panelists today. Preston, Maheen, Melanie, Eleanor. Yeah, thank you for putting it out there, and it's a less popular topic to talk about, and it's potentially pretty packed with like controversial issues, and I think we did it in a really like diplomatic way. Melanie, I want to say we did a good job here, right? But yeah, these are real deal issues that I think clinical training does not prepare us for as civilian clinicians. I can honestly say it does not prepare us for, right? So hopefully if you attended today and you want to learn more, you'll stay tuned. NASW does a lot of work around topics like this topic specifically. Over the years, they're ahead of the curve. I think the first time I presented a moral injury was like 7 years ago with you guys.
Yeah, Aynisa, I think you also are, you don't know it yet, except right now you're gonna know. I think you're also going to be giving a panel in the fall on combat veteran status, because that's on our roster.
Sounds good. Sign me up. But yeah, that the ever-changing landscape, right? That's what we're talking about too, and then building these kind of critical issues and important issues into conversation as we together evolve as a community, veteran community, healthcare community, and like bridging the gap. So we're going to continue these conversations into the afternoon. Preston, you have a comment before we?
Yes, Mr. Nice, you had said something. The U.S. military, and I'm proud and honored to serve and what I did contribute to. But the military can train us to be the best military in the world, but they do not train us for spiritual battles or even how to handle or manage our feelings and our emotions. So that's something, just a thought.
Thank you. Well said. We're going to take a break from 12:40 to 1:10. Is that right? Yeah, about a half hour.
Yeah, that's correct. Enjoy your lunch.
Yeah, enjoy your lunch. Thanks again to the 4 of you and to our attendees to tuning in, being so supportive as well. There were a lot of great comments that came in, so stay tuned. We'll be back in a half hour for our next workshop.
Yep, I'll be triaging some of the questions, as will some of the other panelists. They'll do typed responses, and then the panel that you'll get to come back to is veterans and creativity in service. So that'll be fun. Thank you guys. Thank you, Maheen. Thank you, Preston. Thank you, Eleanor.
Thank you, Ms.